Prop 35.
All right, and folks, there's 2 measures left, so you're almost at the home stretch.
Yes. Pie time, almost.
So Proposition 35 is a measure about a state tax called the Managed Care Organization, or MCO tax. And this is a tax, it's a special state tax on health insurance plans, such as Kaiser or Blue Cross and Blue Shield. And it raises about $7.5 billion to the state each year currently. The state uses this money generally to support Medi-Cal. Medi-Cal is the state's Medicaid program. It covers the cost of health care for low-income people. Now, most of the money from the tax currently is used to help support the existing Medi-Cal program. This means the state doesn't have to spend as much money from other sources, and so it ends up saving the state money. A smaller portion of the revenue is used to support increased services to the Medi-Cal program, for example, higher reimbursement rates to providers. Now, this proposal does 2 key things with the MCO tax. The first is that it permanently approves it under state law. So currently, this tax is allowed in state law on a temporary basis. It ends at the end of 2026. So beginning in 2027, under the measure, the tax would become permanent and remain in effect without having to get approval from the legislature. That said, one important thing to keep in mind is that this tax also requires federal approval to go into effect, and federal approval tends to be for limited periods of time, and that wouldn't change under the measure. So under the measure, the state would still have to periodically seek federal approval to continue to charge the tax. The second thing the tax does is it creates rules around how the state spends the resulting revenue from the tax. Now, the rules are a little complicated. There are one set of rules in the short term in 2025 and 2026, and then another set of rules in 2027. But generally, what these rules would do is require the state to use more money from the MCO tax to increase fund services in Medi-Cal rather than help pay for existing services. In addition, the measure would also require, would provide increases to different kinds of services in Medi-Cal. So if you turn to page, sorry, I didn't get to the page immediately, but if you turn to page 54 of your voter guide on Figure 1, that summarizes the services under current law that get increased services, and then it also shows what would get funding increases under Proposition 35. And you can see there's some crossover between the two, but there also are some that get increases under current law but not the measure, and then some that would get increases under the measure but not current law. In terms of the fiscal effects, in our view, it's helpful to think about the different fiscal effects in the short term, specifically 2025 and 2026, and then in the long term, beginning in 2027. In terms of the short term, there really are 2 key effects I want to highlight. The first is that the measure likely would result in more funding for the Medi-Cal program. And that's because under the rules, the state would have to use more of the tax revenue to provide increased services to Medi-Cal. And when the state provides more funding to Medi-Cal, there typically is also matching funds from the federal government. And so as a result of that, we estimate that the funding increase to Medi-Cal would be between $2 to $5 billion each year in 2025 and 2026. And then second, in addition to that funding increase, there also would be a cost to the state. And again, that's because less money would be available to save the state money. We estimate that cost would be between $1 to $2 billion each year in 2025 and 2026. Now, looking to the long term, beginning in 2027, in our view, these effects really are unknown. And they're unknown because there are lots of uncertain factors at play. Just to give one example, under the measure, the tax would become permanent beginning in 2027. So you could imagine that the measure could result in billions of dollars more tax revenue to the state. However, this tax has been in effect for more than a decade, and the state has a long history of approving the tax for a temporary period of time and then renewing it for another temporary period and then renewing it again and renewing it again. We've done this for a few times over the last more than 10 years. So it's very possible the state would continue to renew the tax even absent the measure. In that case, the measure might not have any impact on tax revenues. And there are other factors at play here that make sort of the overall impact uncertain in our view. Thank you.
All right, so it's healthcare industry groups that qualified this one for the ballot in the first place because they feel that the rates that they're paid for reimbursement for Medicare are too low. So in support, we have the California Medical Association, Planned Parenthood of California, Hospital Association, Dental Association, Primary Care Association, and both major political parties once more. And in opposition, the League of Women Voters of California, the California Pan-Ethnic Health Network, the Children's Partnership, California Alliance for Retired Americans, and Courage California. In support, as far as newspapers go, we have the Sacramento Bee, and then in opposition, the other newspapers that have staked out a position here. In support, we essentially have healthcare organizations throughout the state, and then in opposition in terms of funding, no one has put up money to oppose this one. So it's extremely lopsided, $52 million in favor and no money raised against. What questions do you have?
Just a quick question about the funding increase. So is this that the funding increases under Prop 35 will replace the current funding increases, or is it in addition to?
Yeah, they would replace the current increases. So the state would have to follow the rules as set forth by Proposition 35. So those would replace the increases that have been adopted in current law.
And so the only thing I'd be concerned about is what certain long-term supports and community healthcare workers would be not receiving any more funding. Just the very certain long-term supports, I just wonder what that kind of thing is.
Yeah, I don't have the complete list in front of me, but an example would be community-based adult services. I was trying to remember what the acronym stands for. So those would be one example. I think pediatric day health centers would be another service that's sort of affected. So they are, as you said, it's not every long-term support that was sort of given an increase. It's very specific types of providers.
Okay, thank you.
Any other questions? All right.